A warm good evening, everyone. Thank you so much for joining in. It's a wonderful Sunday again. We're back with the second episode of the International ECON on oral cancer. Today, this year's theme is capacity building for oral cancer. We are now moving ahead and to the next exciting event for the quiz, for which all of our participants have been excitingly waiting once again. So, for the quiz today, let me first announce the prizes which we're going to offer for the quiz program. So the first three participants, the first three winners rather for this quiz competition are going to win scholarship programs, a scholarship for the certificate programs offered by Gujarat University and ICanCare on tobacco cessation. This is the advanced certification. The second set of participants, the 16 participants from 4th to 20th rank positions will also win scholarships, and we're giving them opportunity to learn through these processes. There are gift coupons which are given out by ICanCare to these 20 winners, and also 3 gift hampers will be given to the first 3 winners by Marji Foods. Now, let me give a quick brief insight about what this program is. The Certified Tobacco Cessation Specialist is an advanced program for tobacco cessation and talks about the data-driven and scientific processes for tobacco cessation. It has all evidence-based protocols which is incorporated and researched after dealing with numerous forms of tobacco use in the country in India. And this is driven by most of the faculty and experts in the industry who have really worked hard on this to design this protocol. So with this now, I would like to invite the quiz leaders for the evening, Dr. Dushyant Malik, who is treasurer from Foundation for Head and Neck Oncology, and Dr. Rashmi Shukla, who is senior consultant from Radiation Oncology Max Healthcare. Please talk about what this quiz program is and how it would be conducted for the next 3 days.
So thank you, Shruti. Thank you. So I'm just going to read a few instructions for this quiz. Am I audible, Shruti?
Yeah, ma'am, you're absolutely audible.
Okay, so a very good evening to all of you. So the rules for this quiz is there is online quiz will be conducted on first 3 day of the second International Oral Cancer E-Conclave. For the all registered delegates only. So to win, you have to participate for all the 3 quizzes on the 3 days. The quiz will be have 20 questions on the theme of that day. Points obtained for all the 3 days would be added to select the winner. In case of the fastest timer of submission, total for the 3 days would be considered. Winners would be the highest and fastest total for the 3 quiz. Result will be declared on the last day of the e-conclave, displayed on the ICanCare community page and e-conclave website. All winners will get certificates, scholarships for CTCS, and top 3 gets gift hampers. So there are exciting gift hampers for all of you for the 3 winners. The winners can avail the scholarship in the next schedule online CTCS conclave. Decision by the organizer would be the final and everything. So over to you, Shruti, and go ahead with the quiz. All the best to all of you.
Yeah, thank you so much, ma'am. And now I would like to invite the quiz master for the evening, Dr. Vasanti Jirge. She is professor of oral medicine and radiology from KLE Dental College. Madam is a consultant and reader then, and also co-author for the books Natural Oral Care and Dental Therapy. She is also an internationally certified life coach. Her niche areas are academicians and success coaching for women. So over to Vasanti, ma'am, to please instruct the audience and to begin the quiz program.
Thank you so much. Am I audible to you?
Yeah, ma'am, perfectly.
Yes, thank you.
Sorry, you got muted, ma'am.
Thank you once again. And at the outset, I would like to thank the organizers of this second International E-Conclave on Oral Cancer. Big thank you to Dr. Reena Gupta, Dr. Pawan, and also to you, Dr. Shruti. So without further ado, I would like to proceed with the instructions. As you're all aware, the participants and everyone, that the theme is Approach to Oral Lesions Redefined. And in keeping with that theme, we have the quiz for you today. So the instructions for all the participants are as follows. A link will be shared in the chat box and participants need to open the given link. So fill in your email and name first so that your response can be recorded along with your name. Start answering the questions and you're going to have a total of 10 minutes to answer 20 questions. Your questions are in multiple choice form and pick the right answer. And once you're done, you can submit your responses. The decision of the quiz master and the leaders shall be final. So at the beginning, all the participants will be muted, and the chat box will be disabled so that we do not receive any prompts for answers. And the quiz will have to be submitted within 10 minutes of completion of the quiz. So the fastest and the highest scorer wins. And here is the link. You can type the link, or you can scan the QR code that is given here. Dr. Shruti, you're muted. Are you saying? Are you trying to say?
Share for a moment, because I'm going to put the quiz link on the chat box.
Yes, so the quiz link will be shared on the chat box as well. So here's wishing all the participants good luck. Question number 1. Oral cancer is a public health disease. Which of the following approaches can reduce the burden of oral cancer? Option A, awareness programs in schools and colleges. B, remote diagnosis using mobile health applications. C, banning tobacco and areca nut products. D, oral screening camps. E, all of the above. Question 2. According to WHO, which of the following diseases is associated with the highest mortality, that is death, in low and middle income countries? A, tuberculosis. B, HIV/AIDS. C, malaria. D, oral cancer. Question 3. What is the most cost-effective public health strategy in non-communicable disease control? Specifically, cancer over here. A, aggressive treatment. B, prevention. C, availability of cancer specialists in all hospitals. D, none of the above. Question 4. Oral microbiome signatures in saliva are altered in oral cancer. Option A, yes. Option B, no. Option C, no such studies are available. Question 5. The oral mucosal microbiome reacts with alcohol and tobacco to, option A, deactivate metabolites. B, form genotoxic metabolites. C, none of the above. Question 6. In a resource-constrained setting, for screening and early detection of oral cancer, this can be a useful and cost-effective method. A, mobile devices. B, oral visual examination. C, scopes. D, training of all health professionals. E, none of the above. Question 7. Save the Youth campaign. The save is A, suspension, arrogance, violent, end. B, suspect, adhere, volunteer, end. C, sensitize, assist, volunteer, enforce. D, strike, act, volunteer, end. Question 8. All healthcare professionals should be able to perform an oral examination of tobacco users. A, yes, all healthcare professionals. B, only dental. C, only ENT specialists. D, only nursing and ASHA workers. E, none of the above. Question 9. Which of the following potentially malignant disorder is a chronic areca nut chewer likely to develop? A, leukoplakia. B, proliferative verrucous leukoplakia. C, lichen planus. D, oral submucous fibrosis. Question 10. WHO has a global policy for the control of betel quid and areca nut use. Options are A, true. B, false. Question 11. Which of the following site provides updates on prevalence of tobacco use and preventive programs in India? Options are Global Adult Tobacco Survey India. Option B, WHO. C, Global Youth Tobacco Survey. D, National Health Portal. E, all of the above. Question number 12. Chota Dana campaign promoting oral self-examination by patients is an effective method to identify early oral changes? Options are A, yes, B, no. Question 13. One of the earliest changes in oral mucous membrane in areca nut chewers is A, brown discoloration, B, black discoloration, C, chewers mucosa, D, lichen planus. Question 14. Which of the following oral lesions is a diagnosis by exclusion? Options are A, lichen planus, B, leukoplakia, C, squamous cell carcinoma, D, all of the above, E, none of the above. Question number 15. A simple and cost-effective method to detect oral potentially malignant lesions in screening camps would be. Options are A, chemiluminescence tests, B, colposcopy, C, oral brush biopsy, and D, vital staining. Question number 16. Effective tobacco cessation intervention would include A, active motivation, B, behavioral support, C, comorbidity management, D, drugs and medication, pharmacotherapy, E, B and D only, F, all of the above. Question number 17. Which of the following is a telediagnostic approach for potentially malignant oral lesions and oral cancer? A, telestoma, B, estomatonet, C, oncogrid, D, none of the above. Question number 18. According to the Global Adult Tobacco Survey 2 in 2016, what is the percentage of adults exposed to second-hand smoke at home and workplace? Options are A, 0 to 20%, B, 21 to 40%, C, 41 to 60%, D, more than 60%. Question number 19. The most important reason for failure to quit is A, nagging of the spouse or any of the family member, B, not seeking guidance by specialists, C, poor willpower, D, difficult managing the cravings and withdrawals. Question 20. The only organization in India providing 360-degree care for tobacco cessation is A, IPS, B, ICS, C, ICanCare, D, WHO, E, FHNO. So here's a last question which is compulsory, number C1. Would you practice oral screening and tobacco counseling in your routine after this workshop? So the options are yes, no, I want to start a ICanCare Tobacco Wellness and Oral Screening Center, and the last option is I want to get trained in tobacco intervention. So that is it, viewers. That brings us to the end of the quiz, and all the answers will be available on the community page of Facebook, which goes by www.facebook.com/groups/ICanCare.
It has been put in the chat box. I would request that all the participants who are here right now, they just go to the group Facebook page, and they can join the Facebook page, community page, so they can remain tuned in throughout the sessions. So it has been, please go to the chat box, click at the link which has been given for the community page, and join the page. And you can mention here that you have joined here. Thank you. So this is the TrisCare instrument that has been put here, and there is a special discount for all those who are participants for this. So besides the various things that has already Shruti has said, that the scholarships, then you get the Maji products, and you will be also entitled for all the participants. A special discount code has been generated for you to get this TrisCare product, which is a mouth opener device for all of you at a special cost. Thank you.